So when executives think about heart disease, they often picture the Hollywood style of heart attack, with crushing chest pain, clutching their left arm, or collapsing into a ballroom. But in reality, cardiovascular system rarely fails without any warning. The very first warning often doesn't just happen in your chest. It could happen much lower down. And because embarrassment or denial, many men in their 40s ignore it until it's too late. So today, we're gonna have a grown-up conversation about a very sensitive topic. Now, you might think it's a lifestyle issue, but as a vascular specialist, I see it as a critical red flag. Welcome back. I'm Dr. Peter Chang, and this is where my background as a triple board certified specialist and specifically as the director of vascular medicine is critical. Most doctors treat heart and the genitals as separate systems, but as a whole system specialist, I know they are connected by the exact same plumbing. And today we're talking about the canary in the coal mine for vascular disease, erectile dysfunction, and its lesser discussed cousin, leg cramping. Why are we talking about the bedroom in a heart series? Well, because it's purely a matter of physics and pipe size. Now, look at the geometry. The arteries that are supplying your heart are roughly 3 to 4 millimeters wide. And the arteries that supply blood flow to an erection are much smaller, about 1 to 2 millimeters wide. So if you have a systemic inflammation, high cholesterol, high blood pressure, plaque is building up everywhere. Which pipe gets clogged first? The wide one or the narrow one? Well, the answer is the narrow one. So erectile dysfunction is essentially angina of the pelvis. It means blood flow is restricted. It's frequently the very first physical manifestation of a systemic vascular disease. Here's the reality that I share with my patients. Clinical studies actually suggest that there is often a 3 to 5 year window between the onset of vascular erectile dysfunction and a major cardiovascular event like a heart attack. So if you're experiencing performance issues in your 40s, your body is already giving you a loud, clear warning sign. The plaque is already there. It just hasn't blocked the bigger heart arteries yet. If you ignore the canary when it stops singing, you're ignoring the lack of oxygen that will eventually hit the whole system. Now, the other warning signs is in your legs. Now, have you ever gotten cramping in your calves when you're walking to the MRT or climbing stairs, but it goes away right after you get some rest? Well, we call this claudication. It's essentially a heart attack in your leg muscles. In my years running the vascular lab, I saw thousands of patients who ignored this. Now, if you have blockages in your leg arteries, the probability that you also have blockages in your heart is extremely high. And this isn't just about getting old, it's peripheral artery disease. So what is the strategy? Well, if you notice these issues, do not just go online and buy a blue pill. The pill might mask the symptoms for one night, but it does absolutely nothing to treat the rusting pipes that's causing the problem. You need a vascular audit. This is where we check your lipids, check your blood pressure, and check something called ankle-brachial index. We treat the root causes, the pipes, and not just the symptoms. So in the next episode, we're going to look at the field that is clogging these small vessels faster than anything else in Singapore, the sugar trap. I'm Dr. Peter. Listen to the signals, protect the system.